Stop the dengue transmission cycle. Early detection, rapid response with the 3-3-1 strategy. The tropical zone is characterized by consistently high temperature and humid weather throughout the year, making it a hotspot of biodiversity. High temperatures accelerate metabolic processes, causing disease vectors to grow and reproduce more rapidly. As a result, people are at greater risk of vector-borne diseases. The high epidemic of vector-borne disease worldwide, include Thailand, is dengue fever, which is transmitted by Aedes mosquitoes. Factors contributing to outbreaks include climate change, which affect a mosquito's life cycle faster and expand into unendemic areas, as well as population movement and increased cross-border travel, which facilitate rapid disease transmission. Dengue fever is caused by bites from infected Aedes mosquitoes transmit the dengue virus. After infection, the virus multiplies in the human body. When another mosquito bites an impatient and then bites others, the disease continue epidemic. After being bitten by an infected mosquito, symptoms typically develop within 5 to 8 days. These include high fever, headache, muscle and joint pain, and sometimes a rash. Currently, there is no specific treatment for dengue. Management is based on symptoms as diagnosed by a physician. Importantly, medications such as ibuprofen or aspirin, there are NSAIDs drug group, should be avoided as they may worsen the severity of the disease. We should prevent ourselves and our families from mosquito bites to reduce transmission risk, such as by sleeping under mosquito nets and using insect repellent. And control mosquito breeding sites every week to reduce mosquito populations in the larval stage. If suspected dengue symptoms such as persistent high fever, headache, and body aches do not improve after taking medication, should go to see the doctor. Health staff record patient symptoms investigation. Based on clinical history investigation, 2 to 3 days of high fever, headache, body pain, and the presence of rash, dengue fever is suspected. The laboratory requirement for diagnosis by a rapid diagnostic test, RDT. The test result is positive for dengue infection. The patient is referred to a center hospital for further treatment. Once a suspected dengue case is reported, early action must be taken to cut the transmission cycle using the 3-3-1 strategy. The case must be reported into the surveillance system within 3 hours after diagnosis. Within 3 hours of reporting, outbreak investigation is conducted. Breeding sites in and around the patient's house are eliminated, and adult mosquitoes are controlled using aerosol sprays indoors. The hospital notifies local vector control team stakeholder to control adult mosquito within 1 day. Mosquito insecticide spraying is carried out during daytime, related with the biting behavior of Aedes mosquitoes, within a 100-meter radius of the patient's house, along with larval breeding source control. Additional spraying is conducted on days 3 and 7 to reduce newly emerged mosquito populations. Larval surveys and control within a 100-meter radius on day 7, and expanded to the entire village on days 14 and 21. Surveillance for second-generation cases is conducted on days 14 and 21. Within a 28-day period after the initial report, continuous weekly monitoring and larval control activities are maintained in the community. Health Region 12 provide international prevention and control standard services for people.